The moment I arrived at the Galactic Medical Academy, I knew I was in for an experience unlike anything back on Earth. The station itself was an architectural marvel, an enormous floating facility that drifted in a stable orbit around a swirling gas giant with more colors than should be legally possible. Vast windows offered a view of the stormy clouds below, while sleek metallic corridors stretched in every direction, leading to lecture halls, medical labs, and training wings filled with cutting-edge technology. It was supposed to be the pinnacle of medical learning in the entire galaxy, drawing in the brightest minds from every known species, and somehow I had been accepted. Well, accepted might be a strong word, more like tolerated under extreme protest. As the first human to ever attend the academy, I had been warned that I'd be under intense scrutiny. Not all species were particularly thrilled about our medical practices, and some openly questioned if humans could even be considered doctors by galactic standards. Of course, I figured that was just academic snobbery. Medicine was medicine, right? No matter what species you were treating, the fundamentals had to be the same. I quickly realized how wrong I was. My first clue came the moment I stepped into the grand lecture hall for my introductory class. The room was vast, lined with hovering display screens that projected intricate holograms of alien anatomy, each more complex than the last. The seating arrangements were unconventional. Some students sat in floating pods, others clung to walls or rested in fluid-filled basins that accommodated their biological needs. I had no idea where to sit until a mechanical assistant rolled up and directed me to a human-accessible seat, basically a reinforced chair with straps, as if they expected me to suddenly fling myself into chaos at any moment. I took my seat between two students who could not have been more different. To my left was a shimmering, gelatinous being named Glorplax, whose translucent body pulsed in shifting colors depending on its mood. To my right was Dr. Unit 779, a collection of intelligent nanites that occasionally rearranged themselves into different configurations, sometimes forming something vaguely resembling a humanoid shape, but mostly hovering as a shifting cloud of metallic dust. The moment I sat down, I noticed Glorplax subtly inching away from me, his color shifting to an anxious shade of green. Dr. Unit 779 emitted a soft bzzz and ran some sort of diagnostic scan on me. Then the instructor arrived. Dr. Rilkar was an imposing figure, even by alien standards. He belonged to a species called the Vrelk, towering reptilian beings with deep crimson scales and piercing golden eyes. His long clawed fingers twitched as he took in the classroom, and when his gaze finally landed on me, his nostrils flared in distaste. "Ah, the human," he said, his voice thick with condescension. "I see they have allowed you entry. Fascinating." I opened my mouth to respond, but he had already turned away, gesturing toward the glowing holograms that now filled the room. "This is the finest medical institution in the galaxy," continued, ignoring me entirely. "Here, we study science, not the primitive, outdated methods certain species still cling to. If you wish to remain in my class, you will do well to remember that." I frowned. "Wait, primitive methods? What do you mean?" Dr. Rilkar turned to me with a look of almost theatrical disgust. "Human medicine is a collection of crude, medieval techniques held together by sheer stubbornness and an alarming disregard for basic biological safety." I blinked. "That's not true." "Oh? Tell me, human," he said, his golden eyes narrowing. "Is it not the case that your people still practice the barbaric art of cutting patients open to treat internal injuries?" The entire room gasped. Glorplax made a noise that sounded suspiciously like a squeak. Dr. Unit 779 flashed a bright red warning signal. I frowned. "You mean surgery?" Another collective gasp. One student actually fainted. Dr. Rilkar shook his head as if I had just admitted to consuming live prey in the middle of class. Unbelievable. This is precisely why I opposed your admission. I have seen countless species advance their medical science to levels of elegance and efficiency beyond your comprehension. We use nanite reconstruction, molecular regeneration, biosynthetic tissue sculpting, and yet you... He jabbed a clawed finger in my direction. Your species still relies on blades to cut flesh apart like some primitive butcher. I was about to argue, but a nervous Glorplax quickly interjected. If I may, he said, his gelatinous form trembling, do humans also manually extract organs? I stared at him. Well, yeah, if we need to perform a transplant. Another fainting student. Dr. Unit 779 emitted what sounded like an electronic scream. Dr. Rilkar rubbed his temples as if I had given him an actual migraine. Unbelievable. I sincerely hope you do not bring any of your practices into my classroom. At this point, I was beginning to feel a little defensive. Sure, surgery sounded brutal if you weren't used to it, but it worked. Look, I don't know what kind of high-tech solutions you guys use, but human medicine is perfectly effective. Our survival rates speak for themselves. Yes, Dr. Rilkar sneered, because your species is a biological nightmare with an appalling tolerance for suffering. If you think your butcher's methods will impress anyone here, you are sorely mistaken. I clenched my jaw, determined to prove him wrong. I didn't realize just how much proving I was about to do. The first real test of my abilities came during a live surgical demonstration, and I had no idea it would turn into a defining moment of horror for the entire Galactic Medical Academy. The patient was a large, fur-covered alien from the Bolvani species, a creature with redundant hearts, regenerative tissue, and an immune system so aggressive it could fight off infections before they even took hold. This was supposed to be a simple operation, just the removal of a small parasitic growth that had attached itself to the creature's secondary liver. Routine, easy, and according to Dr. Rilkar, an opportunity for us to observe proper surgical techniques. I was excited. Finally, a chance to prove that human medicine wasn't the crude, barbaric practice the other students seemed to think. It was. That was until the first set of surgical tools were presented. The other students gathered around the operating table, murmuring in awe as Dr. Rilkar gestured toward a floating tray of sleek, futuristic instruments. There were molecular dissolvers that could break down unwanted tissue with absolute precision, nanite-infused forceps that could repair damage at a microscopic level, and even a neural harmonizer designed to keep the patient's pain receptors completely disengaged throughout the procedure. It was all very impressive and, I had to admit, far beyond anything I had ever worked with back on Earth. Then the professor turned to me. "And what instrument, pray tell, does the human plan to use?" he asked, his tone dripping with condescension. Reached into my medical bag and pulled out a stainless steel scalpel. Silence. The reaction was immediate and, in hindsight, predictable. Glorplax made a strangled gurgling noise and scooted as far away from me as possible without falling off his platform. Dr. Unit 779 emitted a loud error noise, flashing a bright red warning light in what I could only assume was pure mechanical distress. A bird-like student let out a horrified screech, and another student, a fish-like alien covered in shimmering scales, promptly fainted. Dr. Rilkar's face twisted into something between disgust and outright disbelief. "A blade," he hissed. You plan to cut the patient open?" I frowned. "Well, yeah, that's how surgery works." Glorplax turned an even paler shade of blue. "You mean you're going to physically slice into their body with a knife?" I blinked at him. How else would I get the parasite out? The classroom immediately dissolved into chaos. Several students began shrieking in their native tongues. One of them activated a personal emergency beacon, a floating Drone recording the demonstration exploded from sheer distress. Dr. Unit 779 restructured itself into a defensive formation, as if bracing for an attack. Dr. Rilkar slammed his claws on the table, silencing the uproar. "This is precisely what I meant when I called human medicine barbaric," he snarled. "No species in their right mind would resort to such crude methods. We have technology, we have advancement, and you," he jabbed a claw in my direction, "want to butcher the patient like some primitive animal." I was starting to get annoyed. "It's not butchery, it's controlled surgery. Look, human surgeons perform operations like this every day. We use scalpels, forceps, sutures. It's a precise, calculated process." Dr. Rilkar recoiled, as if I had just admitted to eating raw flesh. "You sew them back together afterward? Like some deranged textile worker?" I exhaled slowly, trying to stay calm. "Yes, with stitches or staples, sometimes even glue." I nodded along. Finally, something I understood. She gestured toward a simulated patient, a life-sized artificial humanoid with a deep synthetic laceration running along its side. "For this exercise," she continued, "we will practice using biospray polymerization, a method that seals wounds instantly by reconstructing cellular bonds." The other students nodded in understanding. Glorplax, still pale from our last encounter, raised a trembling tendril. "And if biospray is unavailable?" Professor Chirkala's antennae twitched. "Then one must stabilize the patient by inducing localized tissue suspension until proper equipment can be acquired." I cleared my throat. "Or," I offered, "you could just use stitches." Silence. Professor Chirkala turned to me slowly. "Excuse me? You know, stitches, sutures. Just close the wound manually." Several students physically shuddered. Dr. Unit 779 emitted a static burst of what I could only assume was pure digital agony. Glorplax actually squeaked. Professor Chirkala regarded me with the same expression one might give a person who had just proposed eating the patient. "You mean to tell me," she said carefully, "that if you were stranded without medical supplies, you would sew the patient's flesh together by hand?" I nodded. "Yeah, it's a standard field technique." Professor Chirkala's mandibles clicked together in horror. "You would treat a living being like a torn piece of fabric." "Well, when you put it that way, it sounds weird, but—" Glorplax let out a panicked wail and began hyperventilating. One of the reptilian students recoiled so violently that they fell out of their chair. A small avian student covered their... Beacon whispered, "Monstrous." Professor Chirkala took an unsteady step back. "And how exactly would you—" She swallowed hard, clearly regretting even asking the question. "Perform this suturing." I hesitated, sensing that my answer might make things worse. But at this point, what was the harm? "Well," I said, "you disinfect the wound, use a needle and medical thread, and carefully stitch the edges together. Then you tie it off and make sure there's no tension on the skin." Glorplax fainted on the spot. One of the avian students let out a piercing shriek. Dr. Unit 779 immediately sent out an emergency transmission. Professor Chirkala physically dropped her laser pointer. Her antennae twitched wildly, her mandibles clicking as if she were suppressing a full-blown anxiety attack. This is beyond barbaric," she whispered. "You stab the patient with a needle, over and over, and tie them shut?" I frowned. "Would you rather just let them bleed out?" The entire class erupted into pure, undiluted panic. I watched in stunned confusion as several students fled the room outright. One activated a personal distress beacon. Dr. Unit 779's emergency signal was already broadcasting on a loop. The classroom's AI assistant chimed in with a calm yet concerned voice. "Alert! Widespread student distress detected. Initiating crisis protocol." I threw up my hands. "Okay, seriously, how do you guys expect to treat injuries in an emergency? What if there's no biospray, no molecular regeneration, no advanced technology at all?" Professor Chirikala just stared at me, her entire body trembling. "You improvise," I continued. "You use what you have. You do whatever it takes to keep the patient alive, because that's what doctors do." The silence that followed was thick with terror. Finally, Professor Chirkala turned to the remaining students and said in a hoarse whisper, "Class dismissed." And then she fled the room. I sighed, rubbing my temples. This was going to be a very long semester. By the time my next class rolled around, I had officially been labeled as some kind of medical horror. It didn't help that my reputation kept growing with each retelling of the previous incidents. Apparently, in less than a day, I had gone from being a simple human medical student to an unhinged, flesh-mangling butcher who delighted in stabbing open living beings and tying them back together like grotesque biological craft projects. Needless to say, no one wanted to be my lab partner. This became a problem when I walked into our next course, trauma response in extreme conditions, and found that we were expected to work in teams. I scanned the room. Every alien student carefully avoided my gaze, shuffling closer to one another, as if my very presence might infect them with whatever twisted meat-stitching madness humans apparently practiced. Even Dr. Unit 779, a literal collection of nanites, had positioned itself protectively behind Glorplax, as if afraid I might suddenly decide to start suturing machines. Professor Vrix, a multi-limbed arthropod with an air of absolute authority, clacked her mandibles. "Pair up," she instructed. "Today's exercise will involve a simulated mass casualty scenario. You will work with a partner to triage, stabilize, and transport an injured patient under hazardous conditions." I took a deep breath and turned to the nearest student, a lanky reptilian with dark green scales. "Hey," I said, keeping my tone casual, "want to pair up?" The reptilian student's pupils dilated in sheer terror. Without a word, they turned and bolted straight out of the room. I sighed. Professor Vrix watched this unfold with what I hoped was academic neutrality. "It seems," she observed dryly, "that you are experiencing some difficulty finding a partner." I crossed my arms. "Gee, you think?" The professor considered me for a moment, then let out a series of sharp clicks. "Very well, you will be partnered with me." The room went dead silent. I glanced around. Every student had frozen in place, their expressions a mix of horror and morbid fascination. Glorplax actually gasped. One of the avian students whispered, "May the stars protect her." I ignored them and nodded. "All right, let's do this." Professor Vrix led me to the simulation bay, where a holographic disaster zone flickered to life. The environment was a simulated battlefield, collapsing structures, fire, and the distant sound of alarms. In the middle of it all lay our patient, an artificial humanoid model with multiple simulated injuries. The objective, Professor Vrix said, is to keep the patient stable until evac arrives. She crouched beside the model and gestured. "They have sustained blunt force trauma to the torso, a deep laceration along the leg, and possible internal bleeding. Standard emergency procedures dictate—" "Tourniquet first," I interrupted. "The leg wound is a bleeder. If we don't stop that, nothing else matters." The professor hesitated for half a second before nodding. "Agreed. Proceed." I immediately pulled a strip of fabric from the simulation kit and wrapped it tightly around the model's upper leg. "All right, bleeding is controlled. Next priority." I was about to check for fractures when I realized the entire class was staring at me. Not just staring, watching, whispering, recording. I ignored them and focused on the patient. "Blunt force trauma," I muttered, pressing gently along the torso. "No obvious flail chest. Breathing is even. Could be cracked ribs, but probably no punctured lung." Professor Vrix clicked thoughtfully. "Acceptable reasoning. Treatment?" Grabbed a stabilizer wrap from the kit and secured the patient's torso. Compression wrapping. It'll keep the ribs from moving too much until we can get them to a proper med bay." There was a long pause. Then the professor let out a low, thoughtful rumble. "Efficient," the class gasped. I paused, looking up. "Wait, what, Professor?" Vrix gave me an approving look. "Efficient," she repeated. "Methodical, practical." The class collectively lost their minds. One of the avian students clutched their chest. "She's praising it." Glorplax's entire body quivered. "The human is earning approval?" Dr. Unit 779 blinked its optics rapidly, as if trying to process a fundamental impossibility. "Error does not compute," I groaned. "Oh, this is just basic trauma care. How do you guys handle battlefield injuries?" Professor Vrix answered before anyone else could. "In most cases, we prioritize sedation and cellular stasis. Our technology halts biological deterioration until proper surgical intervention is available." I nodded. "And if you don't have that tech?" Silence. One of the reptilian students shuffled awkwardly. "We wait for them to die?" I stared at them. "You what?" "It is the most humane option," Glorplax murmured. "Better to let them pass peacefully than endure that." He gestured vaguely at me. I pinched the bridge of my nose. "Guys, if you have the means to keep someone alive, you use it. You don't just give up because your fancy tech isn't available." Professor Vrix studied me carefully. "And that," she said at last, "is why humans are so terrifying." I blinked. "Come again." "You do not surrender to circumstance," she said. "You adapt. You refuse to let death take what can be saved." She considered me for a moment longer before nodding in satisfaction. "I approve." The entire class let out another collective gasp. Glorplax fainted again. Dr. Unit 779 beeped wildly. "Critical event detected. Restarting system." One of the avian students shook their head in awe. "The professor approves of the human. The end times are upon us." I sighed. At least I finally had a partner. By the time our next class rolled around, my reputation had gone from medical horror to something even worse. A respected medical horror. It turns out that Professor Vrix's approval had carried weight. A lot of weight. Now, instead of just fearing me, my classmates had started regarding me with a mixture of awe and deep existential concern. They whispered when I walked by. They took notes when I spoke, and most unsettling of all, they had started asking me questions. It began innocently. "Enough!" A small, nervous avian student fluttered up to me before class, their feathers ruffled in what I could only assume was apprehension. "Excuse me, human liaison," they chirped, using the official title that the Academy had, for some unfathomable reason, assigned me. "I have an inquiry regarding your species' emergency medical practices." I sighed. "Look, if this is about sutures again, I swear—" "No, yes, but also no. I was wondering." They fidgeted. "Is it true that humans use fire to treat wounds?" I stared at them. "What? Fire?" they repeated. A student in the lower cohort said that if an open wound becomes infected, humans will burn it out with heated metal. There was a horrified silence as the surrounding students visibly cringed. I ran a hand down my face. "Okay, first of all, we prefer antibiotics. But if we don't have those, and infection sets in, then yeah, cauterization can work in extreme cases." The entire group gasped. One of the reptilian students made a distressed wheezing sound. Glorplax, who had apparently recovered from his latest fainting spell, quivered violently. You mean to say," he stammered, "that if an infection becomes severe, you will apply fire directly to the flesh?" I sighed. "Look, it's not ideal, but in a survival situation, it's better than dying of sepsis." The horror on their faces was palpable. The avian student fluffed their feathers and took a hesitant step back. "That is deeply troubling." Before I could respond, another student, this one a tall, willowy amphibian, raised a tentative hand. Is it also true that humans can survive losing limbs? I blinked. Yeah. I mean, assuming proper medical care, sure, we can adapt. Another gasp. The reptilian student from earlier hissed in alarm. But how? Well, I shrugged. Modern prosthetics help. But even without those, we just learn to compensate. Humans are pretty good at working with what we've got. The room filled with frantic whispering. Dr. Unit 779 let out a static-laced whir. Clarification required, it said. Does this imply that a human may continue functioning at full capacity despite catastrophic structural damage? I hesitated. I mean, not full capacity, but we adapt. There was another round of horrified muttering. One of the insectoid students raised a trembling limb. And what about extreme pain? Is it true that humans can simply ignore it? I frowned. Well, not ignore it, but we have a pretty high pain tolerance compared to most species. Dr. Unit 779 immediately began beeping. Correction. High pain tolerance is an insufficient descriptor. Records indicate that human test subjects have endured acute tissue trauma while maintaining operational awareness. I sighed. Are you talking about that one study where a guy had a railroad spike go through his skull and lived? Because that's not normal. The reptilian student let out a choked screech and covered their face. The avian student collapsed into a chair. Glorplax just whimpered. Professor Vrix entered the room at that exact moment, her many eyes surveying the scene. I see we are once again discussing the terrifying resilience of the human species. I threw up my hands. I didn't start this conversation. The professor chittered in amusement. Perhaps not, but it was inevitable. She turned to the class. Settle down. Today's lesson is hypothetical worst-case medical scenarios. There was an immediate wave of distress. Glorplax groaned. As if we are not already discussing nightmare scenarios. Professor Vrix ignored him and activated the holoprojector. A new simulation flickered to life, displaying an image of an alien patient, one of the fragile aquatic species from the outer colonies, lying prone with a severe abdominal wound. In this scenario, the professor explained, you are stranded on a hostile planet with no access to advanced medical supplies. The patient has suffered an evisceration. What do you do? A heavy silence settled over the class. Then slowly, all eyes turned to me. I sighed. Are you guys seriously expecting me to answer this? Professor Vrix just looked amused. You are the foremost expert in primitive, last-resort medical techniques. I groaned. Fine. If you don't have biogel or cellular repair tech, then you clean the wound, push the organs back inside, and hold everything in place with whatever sterile material you can find. Cloth, bandages, whatever. Then you apply pressure and pray the patient doesn't go into shock before evac arrives. The class lost its collective mind. Glorplax fainted again. Dr. Unit 779 froze mid-calculation. The reptilian student actually dry-heaved. The avian student squawked in horror. One of the insectoid students made a strange clicking noise and bolted for the exit. I rubbed my temples as Professor Vrix let out a satisfied hum. Excellent, she said. Class dismissed. I groaned. This was never going to stop, was it? By the time the next class rolled around, I had officially stopped trying to convince anyone that human medicine wasn't some kind of nightmare ritual. The rumors had taken on a life of their own, spiraling into bizarre exaggerations that I was powerless to stop. According to the latest round of whispering, humans could allegedly reattach their own severed limbs with nothing but sheer force of will, could digest their own bones in times of starvation, and, my personal favorite, could return from the dead if they were stubborn enough about it. Wasn't even going to try arguing with that last one. So when I walked into advanced multi-species surgical techniques and saw that every other student was actively cowering away from me, I just sighed and took my seat without comment. Professor, Vrix clacked her mandibles in greeting. "Ah, human liaison. I trust you are prepared for today's practical exam." That got my attention. "Wait, exam?" The class collectively shuddered. Professor Vrix gave me an approving look. "Yes, you will be performing live surgical procedures on simulated patients under observation." Glorplax whimpered audibly. I frowned. "Okay, but this is still just a simulation, right? I'm not actually cutting into a living person, Professor." Vrix chittered in amusement. "Of course not. That would be unethical." The class exhaled in relief. "However," she continued, "the simulations have been adjusted to mimic real-time biological responses, including pain reflexes, vascular pressure, and involuntary movement." The class inhaled in horror. I raised an eyebrow. "So basically a really advanced practice dummy?" Professor Vrix nodded. "Precisely." I shrugged. "All right, that's fine." The class did not think it was fine. One of the insectoid students made a distressed clicking noise. "The human is unbothered." Glorplax buried his face in his tendrils. "Of course it is." Professor Vrix activated the simulation bay, and a row of holographic patients materialized on the operating tables. Each one represented a different species, complete with unique anatomies, organ structures, and medical needs. The objective was to identify the problem and perform the correct surgical intervention within a limited time frame. The professor gestured. "Begin." The students hesitated, exchanging nervous glances. I, on the other hand, immediately assessed my patient. A reptilian model with a deep abdominal wound and signs of internal hemorrhaging. "All right, this one needs an exploratory laparotomy," I muttered, grabbing my instruments. The class watched in morbid fascination as I made my first incision. "It's cutting again," one of the avian students whispered in horror. "Doctor Unit. 779 beeped, observing, analyzing, processing existential dread." I ignored them and worked quickly, isolating the ruptured vessel and sealing it with the simulated cauterization tool. I double-checked for any other damage, sutured the incision, and stepped back. "All right, that one's stable. Who's next?" The room was silent. I looked up to see that every other student was frozen in place, staring at me like I'd just performed some kind of dark magic. Glorplax was trembling. "It did that in under 3 minutes." The reptilian student beside him clutched their head, and it did not hesitate. The avian student took a shaky breath. "It is as though the human was born to wield the blade," I sighed. "Guys, this is just basic surgical training." Professor Vrix studied me thoughtfully. "Your efficiency is remarkable. Your species' adaptability is well documented, but your instinctive approach to invasive procedures is truly unique." I shrugged. "I mean, humans have been doing surgery for centuries. We had to figure it out before we had fancy biogel and stasis tech." One of the amphibian students made a choking sound. "You mean, before advanced technology, humans just cut each other open and hoped for the best?" I hesitated. "Well, I wouldn't phrase it like that, but..." The entire class erupted in horrified whispers. Dr. Unit 779's optics flickered wildly, recalculating. Conclusion: humanity is unstoppable. Glorplax let out a miserable groan. "This is no longer a medical academy. This is a nightmare from which we shall never awaken." Professor Vrix merely looked pleased. "Excellent work. Human liaison. You have demonstrated remarkable surgical prowess." The class stared in stunned silence. Glorplax slumped against the table. "We are all doomed." I pinched the bridge of my nose. This was getting ridiculous. By the time our final class of the semester rolled around, I had completely given up trying. To convince my classmates that human medicine wasn't a terrifying ordeal of blood, guts, and sheer force of will. At this point, they had come to accept my presence the way one accepts an incoming asteroid, an unavoidable force of nature, best observed from a safe distance. The rumors about me had only gotten worse. According to the latest theories, I could allegedly perform surgery on myself while conscious, reattach my own severed head if given enough duct tape, and, my personal favorite, survive in the vacuum of space through sheer medical stubbornness alone. I was about to correct that last, when I realized that, honestly, at this point, it just wasn't worth the effort. So when I walked into multi-species emergency field medicine and the entire class flinched, I just sighed and took my usual seat. Professor Vrix clacked her mandibles in greeting. "Ah, human liaison. I trust you are prepared for today's final examination." I froze. Final what? The class collectively tensed. Professor Vrix clicked in amusement. "Ah, I see. You did not read the syllabus." I blinked. "We had a syllabus?" Glorplax let out a miserable groan. "Of course it doesn't read the syllabus. It simply charges headfirst into medical chaos, unburdened by the need for preparation." Professor Vrix ignored him and gestured to the front of the room, where a massive holographic screen flickered to life. "Today's examination will be a practical assessment of everything you have learned. You will be placed in a randomized simulation with a multi-species casualty event. Your goal is to assess, triage, and treat as many patients as possible within the time limit." There was a collective murmur of distress. One of the reptilian students raised a trembling claw. "Professor, will we be working in teams?" Professor Vrix paused. Then, with an unmistakable air of malicious amusement, she turned to me. "No," she said, "each of you will work individually." There was an immediate uproar. Glorplax went pale. "Alone? But the human—" The avian student next to him flapped their wings in panic. "If the human is working alone, then, Dr. Unit 779 beeped wildly, calculating catastrophic imbalance. Conclusion: the human will outperform all other participants by a margin of 400%. I sighed. "Guys, come on." Professor Vrix merely looked thrilled. "Begin." The simulation bay lit up, and suddenly I was in the middle of a war zone. The scene was chaos. Injured patients of every species imaginable lay scattered across the battlefield, some bleeding, some unconscious, some in full-blown shock. Automated emergency alerts blared overhead. Smoke and debris filled the air, and I immediately got to work. I sprinted toward the nearest patient, a reptilian soldier with a severe abdominal wound. "All right, buddy, stay with me." I tore open the simulation medkit, applied pressure to the wound, and scanned for further damage. "Bleeding's bad, but you're still breathing. We've got this." The class watched in stunned silence as I moved seamlessly from one patient to the next, barking out assessments as I worked. "Massive chest trauma. That's a needle decompression, not a death sentence. Fractured limb, splint it and move on. We're on the clock. Severed tentacle? Stop the bleeding, stabilize vitals. They can grow that back later." The whispers started immediately. "It's a thriving in this environment. This isn't medicine. This is combat. It's treating injuries faster than we can even process them." Glorplax let out a strangled wheeze. "It was born for this. I didn't have time to care. I kept moving, kept treating, kept saving lives, and when the simulation finally ended, I turned back to the class, hands covered in artificial biogel, heart still racing, and asked, "All right, who's next?" The room was dead silent. Then, slowly, Professor Vrix clacked her mandibles and said, "Outstanding." The class collectively lost their minds. One of the insectoid students fainted. Glorplax buried his face in his tendrils. "We were fools. We never should have let it learn." Dr. Unit 779 made a soft, beeping noise. "Human dominance in emergency medicine confirmed. Conclusion: the galaxy is not prepared." The avian student just squawked in despair. Professor Vrix, however, looked delighted. Human liaison, she said. You have not only passed this course, you have set a new institutional record. I blinked. Wait, really? She nodded. Yes. You have successfully completed more simulated medical interventions in a single session than any student in this academy's history. The class groaned in unison. Glorplax just muttered, "This is how civilizations fall." I sighed, wiping my hands on my uniform. Look, guys, it's not that big of a deal. The entire class howled in disbelief. Professor Vrix merely chittered in amusement. Congratulations, human liaison. You have redefined what is possible in emergency medicine. I crossed my arms. Yeah, well, at least I didn't reattach my own head with duct tape. The class screamed. Glorplax fainted again. And I just gave up.